Hey guys, welcome back to Gather Around ATL episode 5.
Right.
My name is Morgan Green, aka Morgizzo, and I'm one of your co-hosts. And I'm with the Honorable Renata Woods, aka Spud.
Oh, Lord.
Give me a clap. Drum
Yes.
One. And of course, we have the First Lady of Gather Around ATL, Remy with the I, not a Y.
Not the Y.
But today,
Yes.
we have a very, very special guest.
Come on.
Miss Kenara Buchanan.
There we go.
Number one, today we're so excited to welcome Miss Kenara to the Gather Around podcast. She was born and raised in Atlanta, and which was very rare.
Yeah.
Kenara began her journey in healthcare with a bachelor's degree in nursing from Chamberlain University and a master's from Frontier Nursing University. After 6 years of experience as a labor and delivery nurse and her own inspirational water birth, she felt compelled to transition into midwifery. Now, Kenara provides mothers and families with compassionate, empowering care throughout their maternity journey. We're so thrilled to have her today. Welcome, Kenara.
Well, thank you. Thank you. Love you, Bible. Thank you.
I was thinking about that competition you had today. I probably would have failed.
You did good. You did real good.
Thank you.
Yes,
Welcome,
you did.
Kenara. Thank you.
Thank you.
So tell us about yourself.
Yes. Well, first of all, I'm honored to be here. Thank y'all
honored
for
to have you.
inviting me.
Yes.
But yeah, most like what you said, born and raised here in Atlanta. I'm a Grady baby, actually. So
What?
real Atlanta. Yes.
That is so rare to find
That is.
someone in Georgia or in Atlanta, period, who's actually from Atlanta. Everybody's
Yes.
just
A transplant.
Yeah.
Right. Yes.
That's
but
a
no,
lot.
I'm real Atlanta. But I went to Westlake, graduated from Westlake High School, and from there I kind of always knew I wanted to do something in the healthcare field. And so my mom was like, well, let's just go to nursing school. And I'm like, okay. And going into nursing school, I was like, you know what? I love everything about moms and babies and birth. And so I was like, I'm just going to continue pursuing that, and I'm going to be a midwife. And when I got pregnant in nursing school, I really thought like, oh Lord, this is it. It's over with. But I had a midwife, a Black midwife, who was amazing to me. And she was just so inspirational. I was like, I want to do exactly what you do.
Yeah.
And so just my whole birth experience and everything kind of like lit up a fire in me that was just like, yep, this is exactly what I was put on this earth to do.
Wow. Okay.
Yeah.
So many questions in that.
Yeah.
So you said that you went to what high school again?
Westlake.
Westlake High School.
Yes.
And then you went into nursing.
Yes.
So you knew, so when you went to college, you already knew what you wanted to get.
Yes.
What kind of degree you wanted. And so
Yeah.
you specialized in nursing.
Yes.
Cool. Okay.
So for my degree, to be a midwife, you had to get your nursing degree first. So going into nursing school, a lot of times when you're in nursing school, they'll tell you like, kind of keep your options open because nursing can take you far.
Yes.
You can do labor delivery, mother, baby, geriatrics. You can work all ends of the spectrum of life.
Yeah.
But I knew going in like, nope, if it's not pregnant mamas and babies, I don't want it. And even you could ask a lot of my cohort, a lot of my other classmates, they'll tell you like anytime it comes to a birth or anything, I'm like, ooh, that's my thing. I knew then that's what I'm gonna be. And I've had teachers that are like, well, don't limit yourself. And I'm like, no, I'm not limiting myself. I know exactly what I want, and that's what I'm gonna go for. So once I finished school, I worked for a year because that was the requirement for Frontier. Worked for a year, and then after that, I went right back to school for my master's.
Yeah.
Yep.
So you saw something in your midwife that was a reflection of you, I'm
Yes.
assuming. What did you see?
One, when I first got there, she was Black.
Oh,
So that was just like,
yes.
come on.
Clock
T.
it.
Yes. Very much so clock
Okay.
it. And then it made me feel comfortable. Like the space that she allowed was just allowed me to be vulnerable when I had questions. It allowed me to be safe, feel safe with her.
Yeah.
And it kind of was another thing to look at her and be like, if you can do it, I can do it.
Amen.
And then she also was very hard on me because when she found out I was in nursing school and I told her I wanted to be a midwife, she was always like, my appointments would start to turn into like lectures almost.
Yeah.
Like we be talking about the baby, doing
Yeah.
everything, and then she like, okay, what does Perla mean? And I'm like,
Come on.
okay, keep me on my toes.
Yeah.
Yes.
So she was really amazing. And even when it came down to like birth, and I was like, I want to be able to catch my baby. Like I know I can't physically do all of it, but then it got to a point where her head and shoulders out. She was like, okay, reach down and pick up your baby. And I was like,
What you mean, like you?
Yes.
Just whoa.
Like your own
head
kid?
head and shoulders out of what you?
yes.
So how would you even be positioned to do that?
Like this?
So yes, I was
No?
like in the birthing pool, and I was kind of like leaning back.
Because you had a water birth.
Yes, I
Okay.
had a
okay.
She had a
So
water
you was
birth.
Water
standing up?
birth.
No, I was sitting in
down.
a tub.
Okay.
So you're in a tub.
Yes,
The
like
baby's
a
coming
birthing
out,
pool. The
of
baby's
you.
coming out.
Grabbed
Yeah.
her
Oh,
baby.
my
So my
Lord.
midwife was in front of me, in front of the pool, and she was making sure the baby's head and shoulder came out. But once the baby was out, she was like, "Okay, reach down and pick up your baby." So I literally reached down and grabbed her up out of me.
Oh,
How
skin to
was
skin.
How was you
Yes.
able to do that with you wasn't in pain like that?
Oh, I love this question.
I would think somebody.
Love?
You know,
backstory. Ronaldo has 2 children.
Yeah.
Okay, yeah.
So
And
his wife, him and his
but
wife have 2 kids.
we didn't have it like that. We had it in the hospital
right.
both times.
So birth looked different.
And I never looked down.
Okay.
I never looked down.
Why?
Because I didn't
You've
want
got
to. I didn't want to see it.
You've got
Your
to.
child coming out?
I didn't want to see
You
it.
got to do it. Y'all gonna have one more?
No, I'm done. My oldest is 16. I'm not starting over.
I understand that.
But she was, holler, squeezing the hand, all that.
Yeah.
So I couldn't even imagine her trying to reach down and catch the baby.
So a lot
Being in
of
so much
times
pain.
in the hospital, one, they don't give you that option to do that.
All right.
And secondly, I was in pain. I'm not gonna lie and say it didn't hurt. It hurt, but I kind of still was very much in control.
Yeah.
So I still wasn't hooting and hollering. I'm still kind of breathing through. And for me, it took a second for me to snap and realize what she just asked me to do. She was like, reach down, pick up your baby. And I'm like what? Oh, okay. This baby. And then I'm reaching down, I pull her up and I'm like, oh, okay, I did it. Instantly was like, oh my God, I did it. But it was definitely something that I would say my midwife was amazing. Just let me get that experience. Because a lot of mamas aren't going to have that kind of experience.
And for people who don't know, what is a midwife?
Thank you.
Good. I love that kind of question. So a midwife is an advanced practice nurse. So in most states, a certified nurse midwife, which is what I am. A midwife is somebody that cares for women during childbirth. So all the way up until the moment you find out you're pregnant, up until postpartum, after you've had delivery. And then we also care for women outside of pregnancy. So we can do woman exams, pap smears, all that kind of stuff as well.
Wow.
Yeah.
Oh, wow. So what made you want to get a midwife? Part to being one.
To be one or to get one?
Well,
Yeah,
what
why
made
you
you want to
wanna get
get one when you got pregnant?
That's a great question. I knew because I've always loved midwifery, I was drawn to it from different YouTube videos and different shows I watched, like A Birth Story, that I always loved birth. So there was a few YouTube videos that I watched and they had water births and I was like, ooh, that's what I want.
Ooh.
Yeah.
So is there any type of statistic where water births are more welcome to the baby? Does it calm them a little bit more, or what's the statistic in that?
So for me, it's more of hydrotherapy.
What is that?
So that is using water to kind of help with the contractions. So for most women, contractions feel like real bad menstrual periods. So a lot of times if you know, you have a 16-year-old and your wife, when they're having their menstrual, they use that heating pad. A lot of times to help, the water kind of simulates the same thing because it's warm water that you're getting into So if before, I would say my pain is a 9 or 10. Once I get in the water, I say, oh, I'm still feeling these contractions, but the pain may be a 5 or a 6. But then it also, another reason why I chose water birth, it also helps with stretching the perineum so you don't tear.
Well, what's
Perineum.
that?
The perineum, so it's so if this was the vagina, this bottom part of it, that's the perineum.
Is that where the baby come out?
Yeah, so the baby's got to come out the vagina, but it's going to press down
I'm asking.
on the perineum in order to come
So
out.
that's how women say I tore.
Uh-huh,
And
it's
they need
the
to get
perineum.
stitched up.
Yep.
It's right.
So
that part
having
of
the
it.
water
So
birth
their head
temper-
is coming out of
This
perineum?
is so
Yes.
fascinating.
Wait a
The
minute.
baby's head's got to come out the vagina, so this is
Vagina.
the perineum.
Well, I get vagina
But
is
the
a
baby's
general
head comes out
term.
of
This
the-
is you see that skin?
Yeah.
That can be what she's describing.
So the vagina
So it's up
vagina
under
is-
the vagina.
Right.
under
I
the
wish I
vagina.
died.
You know, that's-
I know.
Having
It's
problems
okay.
seeing.
Don't do it.
Don't do it.
All right. So under the vagina, so that's a different area where you use a bathroom at, I'm assuming.
Oh, no.
No.
Same area?
It's just look,
Wait,
it's just
well-
skin. That's it.
You use the
When I
restroom
think of skin,
up
I think
top.
of
right.
what they say, the labia? The
Labia,
lips?
that's on
labia.
the side. Yeah.
All right.
Oh, that's the side. So it's more skin. It's a hole, what she described.
It's not a hole.
No, it's skin.
It's a skin.
Let me
No,
let me
have
find
to
a
get out the
picture.
diagram.
Look at this.
So
Look at my
what's-
hand. Look at my hand.
Yeah,
this
I
is
got
the
you.
vagina hole,
Yeah.
and then that's just the skin.
So that stretches.
Yeah,
Yeah.
Right. And she's saying it can stretch so much as
so
the
that it
vagina
tears.
stretches, it will tear.
So with the water will
skin.
help it
So
not
that's where
tear.
the baby comes out of.
Right.
That's what I'm
Baby's
saying.
coming out
It
of your
can help.
vagina.
It can help.
So it's
but
two
most-
separate
help.
parts.
Yes. So
Gotcha.
look, here goes
But
a
as your
little nice
vagina
one.
stretches, so does that
The
skin
gooch.
under it.
So
And
gooch.
it can
Oh,
rip.
okay. Gotcha.
Is that look? Is that a better?
Okay, yeah.
So you see the opening of the vagina?
Yeah.
Is down here would be like the perineum.
Oh,
And it can
okay. I know what that is.
rip.
And it could tear.
It can rip because the baby's trying to come out and push.
Doesn't a
Oh,
woman's
here.
vagina
Jesus.
expand like 9 inches or something
Oh, wow.
to get the head out?
head out.
10.
So a woman's vagina opens 10 inches. The shoulders,
Because like when you're
completion. So that's
dilating
it.
it
It
around,
can
only
stretch
you're
for
ready,
so
right?
far.
Is that
So you probably
No, 10. 10
How
is
do you-
when you
when you're
ready,
ready?
and when it's time to push.
When it's time.
10 centimeters.
women's bodies are amazing.
So how do you
Yes.
coach a woman through, some women out there may say, I want to do a water birth, but I'm scared. I may not be able to handle the pain. Like but I don't want to do an epidural. How would you encourage a woman to have the courage to say, you know what? I'm going to try it. I can do this. How do you coach a woman through that?
That's a good question. And a lot of moms, we do have that conversation with them. What I say, it starts from the beginning. So I look at labor as like a marathon. And so you're not going to just get up the day of a marathon and just think you're finna run this marathon and be just fine. You've got to prepare for it. So with birth, it's the same thing. So we're getting mamas in childbirth classes, and a lot of their doulas are doing different support. They're helping them breathe through different things. Like my favorite is getting a bowl with ice and water, and then having mamas put their hands in the bowl for about a minute, because usually that's how long contractions are, and then take their hand out. And during that time, like if you've ever felt something really, really cold, it starts to get painful.
Like physically.
Right,
Yes.
physically. So when their hands in the water for that full minute, they start to get painful, and the doula is, or whoever is helping them, they're on the side and teaching them, hey, this is the time that you breathe. This is how you breathe through that, and kind of helping them get into that mind space where they're not focused on the pain.
Okay.
So the process starts prior to the birth.
Absolutely.
Okay.
Absolutely.
Oh, I don't know that.
I say the preparation. So getting mamas in childbirth classes, getting them some doula care. So doulas are our support system. So doulas, they don't deliver the babies. The midwife or the doctors are the ones that deliver babies. But doulas are the support team.
That's how I was gonna
For
ask,
the
what's difference
midwife.
between-
For the midwives, yes, there is a difference, because there are some doulas that do practice as like traditional midwives because they've caught babies before or they've done it, but they don't have the schooling. So if something was to go wrong, then there would be a problem. But usually the doula is just the doula. She's supposed to be the support person, or she or he. Let me say that, because there could be, male doulas. But
Are they?
yeah, sometimes they're, and doulas, I feel like they're we use them for a lot of stuff too. So it's not just doulas during birth. There's postpartum doulas that come to your house after you've had a baby and help prepare meals, or help if you have other kids, watch your other kids while you're healing, stay overnight with you and make sure the baby's good throughout the night so you can get rest. So doulas play a very important role within the birth field. I like the analogy, like what I like to tell a lot of my clients, to kind of like help them see how it's a full spectrum thing. Our doulas, like if we're going out on a voyage, birth is a journey. So if we're going out on the voyage, your doula, they're the ones that got the compass. They're kind of telling us, hey, this is the way we're going. This is what's going on. But they're also on that boat with you, kind of making sure you're good. You've got the things that you need, those supplies that you need. The midwife is the captain of this small ship. And so we're skilled in getting you through this journey of birth and doing all the things that we need to do, as long as you're like low risk and you don't have many problems. Now, OBGYN, which most people see because that's the most common thing, those are also captains of ships, but I think of it as much bigger ships. So they're captains of much bigger ships for moms that are higher risk, that have a lot of other underlying issues or things going on, so where they need extra help, or moms that need cesarean sections or C-sections, those OBGYNs are the ones that do that. Midwives don't perform those things. So we see a lot lower risk patients. We see mamas that have no health issues, no diabetes, no blood pressure issues, anything like that, and are able to deliver without issues. But we're also skilled to, if issues were to come, because of course birth, we don't know what's going to come until that time. We're also skilled with being able to handle those situations as well.
Oh, wow.
So what about like if you're doing a water birth? Like what if something bad happened, or not bad happened? Let's just say they was doing it, and I can't think what show I was watching, but I remember a lady, she was having a water birth. She wanted to have a natural water birth, but then in the midst of it, she changed her mind. So
about going natural or just the water birth?
The whole thing. She wanted to go to the hospital. So what do y'all do then?
That's great. We get them up out the water and get them dressed to go to the hospital.
Wow.
If we're at home. It's your choice always. So if a mama that decided in the beginning, yes, I want a home birth, I want to have this baby at home, and then all of a sudden like, you know what, this is way worse than what I thought it was going to be, we're not going to make you stay at home. Now, if you're crowning, so the baby's head is out, then we're going to have a different kind of discussion.
Right.
I'm not going to put you in the car like that.
We here.
I'm like, we here. We got to buckle down, get this baby out. And then after that, usually all the I want to be gone, it goes out the window.
Yeah. So when you say epidural, I heard you say that earlier, does that mean that if you do a water birth or have a midwife, you don't have an epidural?
Good question. So as far as epidural, those are done in a hospital.
Okay.
Midwives do still work in the hospital. I myself am a midwife that does home births. So if you're doing a home birth with me, there's no epidural. If you decide
so
you want,
birth.
it's a natural birth. So if you decide you want an epidural, that's when we can transfer you to the hospital to get that care.
You know what I find interesting, especially when I hear mothers talk? I feel like when mothers say, hey, I had a natural birth, it's like a badge of honor. You know what I mean? Like, oh, I had a natural birth. I endured all the pain. You know what I mean? Versus someone who had epidural. And I get both sides. And I'm like, number one, that's another reason why I think like women are just so amazing. And the way that you were just explaining your story, how you had a natural birth at home. And
well, no, I had mine at the hospital, AMC, before they closed. My next
you
baby
were
will be
in
at
water.
home. Yeah,
okay.
but I wasn't
Were you
water.
pregnant?
Yeah.
Swear.
Yeah.
Oh my God.
Oh, you're congratulations.
Thank you.
Oh, wow. I didn't know
I probably
that.
should have said that before my bad.
Can
Oh
you
my goodness.
Could you deliver your own baby? Yeah.
No, y'all aren't the first people to ask that either. And it's
Like,
crazy.
you can save some money. Like, I'm gonna just do it
It's
myself.
crazy. No.
Oh, no. I just want to enjoy the process.
Yeah, some stuff you kind of just, you need some extra help with.
Yeah.
But now if it got to that point, like baby's out and I want to reach down and grab the baby, I would do that again. But no, I have a midwife. My midwife that I also work with, Christine Taylor, shout out to her. She's my midwife. Yep.
Okay, so when women get midwives, it's common to have a doula too.
Absolutely.
It's kind of like you're supposed to.
Now, I wouldn't necessarily say you're supposed to, but because most women that are getting midwife, they are more so for that holistic care.
Okay.
And so they want that doula as well, because that doula is going to be there from the beginning to the end. Where a lot of times the midwife, we're there from the beginning to the end, but during labor, we usually come a little afterwards. We're not there the whole time during labor. So that doula is the most important part during labor, because like sometimes early labor can last from hours to days.
Yes.
So we're not going to be at your house
too.
for days. Yeah.
Right.
Yeah.
So we're kind of in communication, constant communication with you and asking how's things going, how are you coping through it and stuff. But we're not going to just be in your house that whole time.
So how do you pay for a midwife or a doula? Is that something insurance covers or out of pocket?
So most of my clients that does have insurance, they tell me that insurance reimburses it.
Okay.
So
they
you
have to pay
out of pocket and then your insurance kind of goes back and cover it. But when we're looking at how much a midwife is and how much it costs to have a baby at home versus going to the hospital, it's much cheaper, like half the price.
Oh,
Like,
really?
Give us give us like a number if you.
How much does it cost to have a baby?
in the hospital? Isn't it like $60,000?
Ooh,
$50,000 to have
that
a
would
baby?
be if everything went wrong. You got a C-section plus like you stayed at the hospital a little longer.
Like more than 2 nights.
Yeah.
So what's like an average?
So an average, and I can say based off my own self, I had a water birth, no epidural. My hospital bill at AMC was around $12,000.
So how are people without health insurance having babies? No, I mean, I'm not judging.
It's just-
It's just a question.
Like, how does it happen?
How does that work if they don't have any health
That's a
insurance?
great question. That's why that hospital closed. Honestly, that's what they say.
Yeah.
but
Like
what's hard,
outstanding bills and-
not keeping up with it. But
Can they
honestly,
turn-
a lot of people can get emergency Medicaid. So
Okay.
When
and
they're
then
pregnant.
when they're pregnant, and the government will pay for that.
Mm-hmm.
So let's say if a homeless woman were to have a baby, they would go to a hospital and the government would naturally pay for that.
Right, because at the hospital we have a law called EMTALA. We can't turn you away, especially if you're laboring. We can't say, "Oh no, you ain't got no insurance. You got to go."
Yeah.
No, it's
So
against the law.
Just be
It says it's
You
called
gotta
what?
just EMTALA.
EMTALA.
Mhm.
So EMTALA is a law that protects women who are pregnant or in labor to
Laboring.
have a baby.
So if say
take
you
it.
show up to the hospital and I don't have insurance, but I'm laboring, or even if I'm not from here, because I've had patients at the hospital that are like from Venezuela or from other places, and they come and they, of course, they don't have insurance. They just kind of have their passport.
Yeah.
We can't turn them away and say, "Oh no, you don't have insurance here. You don't see a doctor here." No, it's against the law. If they've come here, you've got to provide those services.
I'm sorry to interrupt your question.
No, you know what? When I think of two questions, I don't even know if these questions, but when I look at you, let's say if I was to have another baby, and we did hire a midwife, and then I saw you come in, I would think like, she looked like a baby.
She looks so
what,
young.
Like what? Yeah, like what do you know about delivering babies? You a baby yourself? Like, do you get that?
All the time.
Do you?
Mhm.
But
Like,
it's-
she looks so-
They look like, you ain't gonna be.
All the
What you
time.
want? Some like old grandma to come in there?
Yeah.
Oh,
Right,
grandma,
right,
I know what
right,
she's
right.
doing.
Big woman coming in there.
not a slave.
Make it.
Not like slave.
No,
No,
but that's
he's
where
finna get us
granny
canceled.
midwives kind of
Harry
come
Potter.
from. But yeah,
Really?
Cause that's what
what it was back then. Yeah, it was usually somebody's older
even
mother
the
or grandma.
Caucasian people would get the black
Midwives,
to
Really?
deliver them. Yeah.
Okay, I didn't know that.
And then the doulas, I used to think like only like what we call the community that like has the crystals and the oils and the
I don't know what.
Eccentric? I don't know, but I know what
Because
you're talking
yeah,
about.
like
Dr. Umar type of
yeah,
Like
okay.
Erykah Badu, right?
Naturalist.
That's who I think.
In the hospital,
or
we kind of
thought.
call them crunchy granola.
Oh, don't say that because I was just about to say. Never mind.
That's who I look at
Never
like
mind.
to
I'ma
have
cancel
like
my next
doulas
question.
and stuff like that.
No, and that's good. But doulas can be for anybody. Even people that know they want to have a birth in the hospital, know they want an epidural, your doula will still be helpful for you.
So, is there a certification that doulas need to have in order to do that, or no?
Yes, most doulas go and get certified, but it's not like where for a nurse or for a midwife you need a master's degree.
Right.
It's just like a class, like y'all can get certified.
Right.
Just a class that you take.
Really?
And
Like
get
I can
certified.
be a doula?
Absolutely.
I'm done.
You would look into that?
No,
Or just
no,
want
I'm
money?
just saying.
You don't even want to look
No,
back.
no, they didn't even look in the water.
Right, you're not even looking at it.
What?
No,
What?
I'm saying that just like somebody just
It's
like
kind
me.
of good to
Just,
know.
You can do-
Good
yeah.
general information.
Yeah.
Okay, so what is the demographics of people who actually uses midwife? If you
That's
can answer
good.
that.
All demographics.
Yeah.
Wow.
I have white patients, black,
Yeah. What's the most common?
Hispanic. I would say with us it's a mix between white and black.
Yeah.
And I feel like, I could be wrong, but it seems like having a midwife is becoming more common.
Yes.
It's
thank
becoming
God.
more encouraged. It's people are actually getting the information circulating about this amazing resource being a part of your maternal care. I don't feel like in 1993 when my mama had me, people were going around getting midwives.
Right.
I just don't think it was as common. Now I'm hearing people getting night nurses, midwives, doulas. They're more open-minded to having natural births. A lot of women are wanting to get away from epidurals. All my friends that have had epidurals, they have back problems.
Still, yep.
Still.
I've heard of that, yeah.
Yes.
What?
From
Because-
having epidurals. I mean, sometimes that first stick doesn't work. Like you move when that needle's going in, like you can paralyze yourself.
Yeah,
like,
that's what I heard.
It's a very intense
And you can't sue
process.
the hospital, right?
No,
Or can
because
you?
when you sign the consent to get that epidural, it's in there.
So it's like
That could be,
that could be it.
yeah.
So-
How often do that happen though? Have that,
Not often, I would say.
Yeah.
Like somebody being paralyzed by it.
Yeah.
Yeah,
Right.
no.
You know
But
what?
there are lingering side effects that can come from the epidural and your birth, and like even not just midwives, but now women looking into pelvic floor therapy.
Oh, yes.
Like there's
What's
a
that?
lot of things
Pelvic
like when you
floor.
have a baby, you know, like there's pelvic floor therapy exercises that help you kind of like tighten things back up.
Like Kegels?
Bring it back
you've heard of
together.
Kegels?
Yeah. Like women end
To
up
keep
needing
everything
that.
kind of tight.
Yes. And there's a lot of black women getting into that space now
So
to be pelvic floor
tighten
therapy.
it back up, or
The pelvic floor. When we're talking about
To please
we're
their
talking
husband.
about no.
I'm kidding.
No.
I'm kidding. I knew
I
knew you would have got it.
The vagina is very healing. I tell you, that's one of my favorite organs. Yes, ma'am.
Yeah.
so
But the pelvic floor, that's different.
It's different.
So they got this.
That-
Go ahead.
Go ahead.
No, they got this. This is a joke that they got. Like when you know how like men think they like killing a woman, like killing her, and it's like when you see a woman have a baby, it's like you really wasn't doing anything. You know
Very
what I mean?
true.
Like,
Very
What do you
true.
mean?
Because
you know,
Yeah.
you think you
Okay,
killing
okay.
He
yourself
it took
down
him a
there,
minute.
and
He got
it's
it.
like
Look, he got it. He
Oh.
got it.
a whole baby coming out.
I thought you meant killing him by having intercourse when they're pregnant.
Oh no!
Like,
Oh,
but
no.
then you're talking about
Just
See,
activity.
I tore it up.
we're gonna have to edit this.
Did you?
a little
I'm
bit.
done. Listen,
Just that part.
Just that part.
don't
Now,
get me
now
started.
here's another question. Now, how often do a doula or a midwife get into it with the doctor who you see like if I'm a midwife and I know because I work for my client
Mm-hmm.
and I see you the doctor trying to, and I'm like, hey, nah, I don't care what he's saying. Don't do it.
Right.
Do that happen a lot?
Wow.
A lot of times. And
And how's
honestly,
that?
especially with home births, because a lot of times we don't have, so for you to be a midwife in a hospital, you have to have privileges. With that hospital, you got to go through all this extra paperwork and stuff that you got to do to be able to say, yes, I can deliver at this hospital. But so as a home birth midwife, I don't have any of those privileges to deliver at the hospital. So when I send my patients in to be transferred, a lot of times we're getting those back to fights with a lot of doctors because they're like, well, why were you even trying to have a baby at home? Because that's her right. And that's what she wanted to do. She could do that. She has that option.
So I wonder, because I feel like we're now being educated on what a midwife is, right? And my mind just can't help but to think, what about people who aren't fortunate enough to get access to information, like if a teen pregnancy, right? If let's say a teenager is pregnant, they're trying to hide the pregnancy from their mother or their parents or whatever. Like, how will they get the information on what you should and should not do? Can I have a midwife? Is there any insurances that I can apply for? Like, what's the next step? What can they find the next steps for them?
That's a great question. I feel like, honestly, you can find it anywhere. So, like a lot of Planned Parenthood, because first of all, I would
Are they
say
shutting us down? No,
not everywhere.
Okay,
Not everywhere,
Yeah.
but and a lot of them are kind of still like undercover, I guess.
Mm.
But for a lot of anybody that's like a teenage pregnancy, my main thing is definitely getting you some care. So a lot of times that looks like a lot of just like TikTok. TikTok is a big thing for this younger generation.
right.
Yeah.
So a lot of times they TikTok everything.
Yeah.
And there is a lot of information on TikTok, but it doesn't necessarily mean all that information is true.
Yeah.
So for anybody that's wondering or trying to see, hey, is the midwife care, is that for me or not? You can always go to our website, birthbygracemidwifery.com, and we've got lots of information on there as far as what insurance covers, how much is it out of pocket if you don't have the insurance, like what we also even have different plans. So we have plans for moms that don't want to have a home birth, but they know they want midwifery care. It's called a companion program. So we'll see those mamas also throughout their pregnancy while they also see another OB or whoever else their insurance to cover. And then when it's time for them to labor, a lot of them will go to their house and kind of labor with them and then send them to the hospital when they're in active labor. So like 5 or 6 centimeters.
Can you say that website a little bit slowly so the audience can hear you?
Absolutely. It's birthbygracemidwifery.com.
Gotcha. Thank you.
I remember you saying, like y'all aren't sitting in the whole entire labor.
Right.
So what does a day in the life of a midwife look like? Like, are people picking up the phone, calling you at 5 a.m. like, hey, I'm cramping, do you have hours? Is it just kind of, if somebody's interested in being a midwife, what can they expect? What does that look like?
That's good. So I would say, one, it depends on the midwifery role that they're going.
Okay.
So for me as a home birth midwife, it looks different than if I was a midwife in a hospital.
Yeah.
So if I was a midwife in a hospital, most times you're on call for 24 hours. So, and you're staying at that hospital for those 24 hours most times. And so during that 24 hours, you can be getting called at any time of the day, or in the, in the morning, evening, doesn't matter. Babies come whenever they come. And so that is during that 24 hours. But for home birth midwife, we're on call. Me and my partner, we're on call for a week. So let's say I'm on call this week till Monday, and then she switches over and she's on call. So it could look like that. I could have Monday, Tuesday, Wednesday be fine. Nobody's in labor. Nobody's doing anything other than just seeing mamas at the office. And then I might get a call 2:00 in the morning that a mama's laboring or doing some stuff. And I get up and I head that way.
Wow.
And that can be hours, right?
Yeah, it can be hours. Like I said, sometimes labor can be days. So a lot of it is staying in communication with those mamas. Yeah. So usually around 34, 36 weeks, we have our mamas create a birth group chat. So that would include both me and Christine. If they have a doula, their doula, as well as their spouse. And I love to include the spouse because sometimes mamas are... A lot of our moms, because I feel like with home birth, you've got to have a high pain tolerance to like go through labor without anything. So a lot of our mamas are like, I don't want to call unless it's time. And so they're like contracting and their body's doing stuff, but they're like, no, I'm fine. We'll call and we're like, how are you feeling? Oh, I'm fine. I'm having contractions. Oh, I'm having one now, but I'm able to breathe through it. It's fine. And then we'll get a call from the dad and like, no, she's in the closet on her hands and knees, breathing all crazy. Like, I need you now. Yeah.
Why is that?
Because as women, I feel like in that role, we feel like when the midwife comes, I need to be performing. I need to be ready to have this baby. And if you don't feel like you're ready yet, you're like, no, don't come. Because I don't want you just sitting here. Yeah. And a lot of times that be their thing. They be like, I didn't want you to drive out here for no reason. And now I'm on the phone telling your husband how to catch this baby because you didn't call me. You didn't call me.
Yeah.
Okay.
And you mentioned how important a spouse is. So we brought this up on the episode. I have never birthed a child. Morgan doesn't have kids. Ronaldo has 2. In your experience, do you feel a spouse is important and plays a role in women having postpartum depression?
Oh, yes.
Okay. I said that I felt a lot of postpartum depression is not only tied to the changes of the body and the mind, but also the lack of support that they feel they're not getting from their spouse. So if someone makes a decision to say, I'm going to have a midwife and do a home birth, it is pretty important to have a spouse that can coach you through that.
Absolutely. And be supportive too. Yeah. So
people should consider if they have the right type of spouse for that environment.
Yeah, even if you're gonna have a baby at the hospital, because I've worked in the hospital field, and I've had dads where they're on their little sofa asleep, and we're like, "Hey, she's pushing like right now. I need you to get up. She wants you to be right there by her side." So yeah, it definitely does matter. And even as far as postpartum depression, I feel like it matters more so towards the end, because if your partner is not supportive, then that means you're the one got to get up and be superwoman. You've got to handle the other kids or do this and do that when you're supposed to be healing. Yeah. So it can be very stressful on them, which is also why I like to tell my mamas about getting postpartum doulas. So if you have a spouse that's not supportive and that's that's him, he's not supportive, then definitely look into getting a postpartum doula, somebody that'll come to the house, help straighten up, help deal with the other kids, or help with this baby. Absolutely.
I was just about to ask, what would be the purpose of that if they're not getting help? It's like getting a counselor saying, hey, I need help. I can't get my partner help. He or she still doesn't want to help. Now what? You know what I mean? But thank you for articulating that.
Yeah.
I do have a really important question. How do you see your role as a Black midwife in addressing health disparities in maternal care?
Oh, yes, that's a great question. I like that question there. One, I feel like representation matters for sure. So I feel like for a lot of my clients, especially my Black clients, when they come into the office and they see another Black face, they're like, okay, immediately kind of get comfortable and feel safe and like, dang, I can trust her. Like, I feel like, oh, we can just talk about stuff. Or they're able to open up with me. So definitely being able to like provide that cultural competent care, unlike some other providers and stuff, being able to, I've had clients come in and be like, life has just been life. And I'm like, girl, tell me about it. Sit down. Come on, let's talk. Instead of feeling like, okay, no, you came here for your appointment. Let me listen to your baby. Okay, you've been eating good, drinking good. Okay, go ahead, go about your day. Like a lot of other providers kind of like rush through your services. So I feel like I do a lot of sitting down and talking with my clients and kind of just making them feel safe. Because once you feel safe, you can open up about a lot of things. And sometimes as a midwife, it's even more than just being there during that pregnancy. Sometimes we have to intervene and be therapists too, and like really have those moments with those patients. So
they're having life-changing moments.
Yeah, and absolutely.
That's a big deal.
It is. It is. Birth is... It's like nothing you've ever, been through or seen before, because it's all new, especially in the beginning. It's new. And even moms that have done it before, I feel like it's new again, because every pregnancy is different. Every birth is different.
Oh, wow. You just opened my eyes. Like, imagine if you're doing all of that alone.
Right.
Yeah.
That is a scary place to be in, especially, I don't want to talk about any particular races, but I'm just saying, just in general, how, there's a lot of single moms out there. You know what I mean?
By themselves,
and then you created a baby. Now the baby's grown inside of you. It's changing your body.
Yep.
And then you have to figure out how you're going to have the baby, how you're going to afford the baby. And then the biggest part is, that essentially the baby's going to come out of you.
Right.
So you're thinking about having, like, I want to say, I guess, a surgery in some type of way alone, potentially. Like, who's going to be there for me? What kind of support system would I have?
Right.
Can I do this? Is the baby going to be healthy? You know what I mean?
Yeah.
And then afterwards, my body, you know what I mean? What are the changes that are going to happen to my body? Also, do I have the resources?
Yeah.
Speaking of resources, are there any resources that you can tell the audience that they can use to have a baby?
Yeah, there's many books that we have. We've got a lot on our page. Let me give you the names of these books. Oh, where'd I do it? Because I was like, let me make sure I'm ready for all the things. So, and then like I said, on our website, again, we've got a lot of different things.
Resources.
Our Linktree app, we've got lots of resources on there as well. But some of my favorite would be Mind Over Labor. It's a breakthrough guide to giving birth, and that's by Carl Jones. Another one I like is, it's good for moms and dads. It's Birth Partners, the 5th edition. So it's a complete guide to childbirth for dads, partners, doulas, and all other labor companies.
Oh,
so yeah, those are some good ones. And then I would say YouTube, because everybody likes YouTube and being able to look at videos. Yeah. So you can always YouTube some. We've got a YouTube page as well, Birth by Grace. And you can see some home videos that we've done, like of home births. You can also see like preparation stuff that we've done. And you can also see like a lot of families that we've supported and been there, and like see their testimonies as well.
Love that.
I have a controversial. Did I say that right?
Yeah, good job though. Here we go.
Here we go.
So I thought, well, it was a big thing that why Black women would have to get doulas and midwives, because of how many Black women will be dying from childbirth in the hospitals, because this so-called doctors of other races will seem like, because you're a Black woman, you can handle more pain than the average woman. So they will put these women through things that would intentionally kill them. So how true is that, as far as like women, Black women dying mostly when it comes to childbirth?
That's honestly a very true thing. You can look up the statistics now. Absolutely. A lot of gynecology was built on racism. So they were
gynecology?
Right. Yes. Based the study of women's bodies. Yeah. So a lot of it was based on racism. So back then they were thinking, Black women didn't feel pain the same as white women did. So they would do different procedures and different experiments almost without pain medicine stuff. So could you imagine a woman getting a C-section with no kind of pain medicine? She's up and alert for this, and they're cutting her like, oh no, she doesn't feel any pain.
That's what I was getting to when you said you had a client earlier, or you gave an example of a client earlier, literally in the closet giving labor, I guess laboring the baby, right, on her knees. But she didn't want to call you. So in my mind is like, in her brain, I'm like, well, why does she feel that she has to endure that much pain by herself without getting professional assistance?
Honestly, I don't know if I would have the answer to that.
Yeah.
Just because that's kind of what some people go through in their mind. They think that for me, with my daughter, I felt like during labor, I felt like from talking to other people, like, oh, what did it feel like? And a lot of people are like, oh, it's the worst pain ever. You're going to feel like you're dying. I was waiting on that feeling to like, oh, I'm waiting to feel like I'm dying. And then it never, for me, I never felt like that. But when I got to the hospital, I was 7 centimeters. So imagine if I waited at home thinking, okay, I'm waiting until I feel like I'm dying.
I'm good.
Yeah, and I still feel okay. I'm still able to move when I'm not contracting, and I'm still able to go and do. Then I would have probably had my baby at home too.
I feel that it just also relates, not just relates to home birth, but just kind of just people of color just in general.
Yes.
I always hear that, oh, I'm good. I don't want to go to the doctor. I can figure it out. Right. I'm trying to figure out where the root of that comes from. Is it the fact that,
our ancestry?
Yeah.
Just being resilient. Yeah. Being able to endure.
Because we're forced to.
Built tough.
Right.
You know, it's just
we didn't have no choice. We couldn't go to the doctors.
Right. And I think, too, it's a lot for women, because I just know, I have a lot of friends that have had children. And it always used to bother me when somebody would be pregnant and then someone would say, "Who, girl, like, it's going to hurt so bad, this, and that." Like, I don't like
scaring them.
Yeah.
Why would you tell somebody that?
But a lot of women project their pregnancy experiences on other women. So that's another reason why, like I said, when I have kids, I 100% want a doula and a midwife. And I do want a natural water birth. And every time, I don't even really share that with people anymore, because everybody's always like, girl, do you don't want that water birth? Like, when you feel them pains, you're going to be like, give me an epidural. Don't project.
Right.
You don't know
that was
what
your
I can
story.
do.
Right.
So I feel like more women need to hear from people like you and in your profession that you can have a peaceful birth. You can master pain. You can be in a spiritual sense and just so locked in with God or whatever it is that you can get through it. Like you can 100% not let the opinions and the experiences of other women who have had maybe some rough births change your mind about it. So it's very important to seek midwifery and resources to know you can do it.
Absolutely. And for anybody that's like that, like when people come to me and they're like, oh no, it was terrible. I always ask like, well, what did birth look like for you?
Yeah.
So a lot of times they're like, oh, I was at the hospital and they put me in the bed and then I couldn't move. Well, that was why it was painful. You're not meant to labor just on your back.
And then in the hospital you can't eat.
You can't eat, right? Yeah, you should be able to get up and walk. Yeah, a lot of times once they put you on Pitocin, they stop you from eating because the chances of you possibly getting a C-section. So they don't want you to have a full stomach if you need to get a C-section.
So you got to starve, be in pain, be on your back.
Give the most energy you've ever had to exert in your entire, the closest you will ever come to dying from a pain perspective, you're going to do it on ice chips.
To birth a child.
To birth a child. That's the closest a woman's body ever comes to.
They said the closest thing to giving birth is a toothache.
Oh, I don't believe that.
I don't know.
A toothache?
But
toothache can only last a couple of hours.
But they do say toothaches hurt real bad.
Toothaches are terrible.
And it was the worst. I wanted to
like
take
you
my
out of
tooth
your mind. Yeah.
By myself.
It can be like that.
And
but
then I was thinking about like, damn, is a pregnancy worse than this?
Pull her out. Pull her right out.
I'll be trying to pop that baby out.
Yeah.
This is why men can't have babies.
Exactly.
I don't think we could have.
I think I can do it.
No, I feel like
the world
men try to be macho, but no, I don't feel like they can go through half a thing. If I get a stomach cramp, I'm calling my doctor.
Yeah.
You know what I mean? I can't imagine having a stomach cramp every month.
Right.
And bleeding.
Yeah.
And then if you get pregnant, you have to sleep awkwardly. Yeah. Because it's all about the human being inside of you. You have to change your diet. Yeah. Probably throwing up every morning.
In that first trimester,
then preparing, always tired, always having craving. Right.
Come on.
Your feet hurting.
Other kids, care for them.
You gotta take care of your
Then on top of that, your body's changing. Looking at yourself. Now, of course, it's a beautiful thing, right?
Breasts are developing milk.
I've heard women's noses widened or their face get puffy.
Why is that?
Hormones. A lot of it is hormonal.
Hormones changing. And then to have the baby.
Bigger? I didn't never understand that.
Yeah, like women's face spreads.
Yeah, nose spread, yeah.
I think it goes back down, but
Well, what's this rumor about the what's the sac that come out after?
Oh, the
Placenta?
afterbirth. People eat that.
So, yeah,
You can turn it into pills.
people do. That
I heard it has no nutritional value. I heard so many different things.
I
What
really
happened?
want to hear a response on this. But
That's a
people
good
do
one.
that.
Yeah.
People do
And it costs
Eat it.
a lot
that.
a lot of money.
Because they say like let's say if you don't know, this is what they say. This is what I heard.
Uh-huh.
If people don't know, like the hospital would keep it and like sell it.
Now I don't know what they do with it at the hospital.
Why would
To
you
be
eat
honest
somebody
with
else's
you,
placenta?
I've also heard that they'll keep it. It's an organ, so they'll keep it. They might probably doing some of their own research.
Yeah.
To it. Definitely, if you had a high risk pregnancy or something going on, they can go deep into your placenta and like do an anatomy and find out what was going on. If like your placenta was the reason why baby is super small and stuff like that. But as far as eating it, capsules, smoothies, I've heard mamas, they've gotten very intrigued with their placentas, and I'm not knocking anybody that does
Have
it.
you ever known somebody to do it?
I've had some mamas that have wanted to keep their placentas and wanted
Where?
to capsulize it.
Capsulize it. You have to ship it off.
So yeah, there's some doulas here in Atlanta. They offer that program or that
Service?
that service with their other services, and you just pay a little extra for it, I'm sure. But the main thing is like the research behind it, and it's limited research, but the research behind it is that it's supposed to help with breastfeeding as well as postpartum depression. And so a lot of people's main thing was like, well, we're mammals, and most mammals after they deliver their baby, they eat their placentas. Yeah.
I've seen that.
Like if you've ever seen an animal give birth, they eat the placenta after it. But they also do that so that predators don't, smell it and visit, right. So for me, I've had other patients or clients that have used that placenta, because don't get me wrong, it's definitely full of nutrients and stuff. But they've done other things like planted, like put a rose bush or something under it. They put the placenta in the ground, in the soil first, and then put a rose bush or a flower, whatever they wanted, a tree in their backyard, and use that instead of eating it.
So when you do
my vagina did that.
Right. You see that? That's your tree right
So
there.
when you have a birth at home, do you have to tell anybody that you're keeping it?
Keep it. Yes.
So you still do?
Yes. Because if you're not, we just dispose of it. So we just throw it away. We kind of double bag it in a Ziploc bag.
Put it in like a trash or a special place?
So it's kind of the same thing. Like, so in the hospital, they dispose of it, is what they say. Do we really know where it's going?
Yeah.
No, but they say they dispose of it. So in the hospital, if they don't, or at home, if they don't want to keep the placenta, we ask, like, are you going to keep it? You going to do anything with it? They say no. Then I ask, when is your trash day? If it's a Monday and the trash day is Thursday, I say, okay, keep it in the freezer until Thursday and take it out, or Wednesday night. If you put it in the freezer, it kind of preserves it. Like but me. If you like me, but if you put it out, like say it's Monday and you put it out, animals are gonna rummage through your trash because they'll smell it.
I can believe that. If there's someone watching right now and they're like, we're really trying to have a baby, we want to have a baby, what tips and advice would you give them to help them prepare their bodies and their minds to conceive?
Good. That's a good one. Definitely folic acid. That's very good for brain development for baby. And a lot of mamas kind of think they gotta wait until they find out they're pregnant to start prenatal vitamins. You don't. You can, when you decided, hey, I want to go ahead and start trying, go ahead and start taking those prenatal vitamins. It'll help your body. And then another thing I would say is definitely looking now at what kind of birth you want to have, and what that looks like for you. And so you can go ahead and start interviewing those healthcare professionals and seeing who best fits you and your goals. Because for me, I feel like that is so important, to have a team of people that are supporting whatever kind of birth that you want to do, and supporting you throughout that birth, the pregnancy, birth, and labor. And I always so for y'all, I would say, to me, it would be like so you're a barber. So say you went to another barber and like, you're like, okay, I want my hair cut this kind of way. And then they disregard what you say you want. And then they also push your hairline back. The chances of you going back to them is what? Slim to none, right?
I'm gonna give a bad review.
And give a bad review, right. So with women, when they're choosing either OBs or midwives or doulas, I say interview them. Ask them like how they feel about this topic or how they feel about this birth. And if they're showing you now that, oh, they're dismissive or, you know, they're quick to kind of not answer your questions or they're not showing you respect, then that might not be the healthcare provider for you.
Yeah.
And I tell a lot of my mamas, don't feel bad if you started care with somebody and then later you feel like, yeah, I'm not meshing well with them. Don't think that you can't fire them and get another one. Because just like you can let go of a barber and be like, yeah, I'm going to go find me a new one, you can do the same thing during your care as well.
Wow.
How long should you give them?
That's a great question. I wouldn't give them too long because with pregnancy after a certain period, so closer to that third trimester, usually around 28, 30 weeks, a lot of other providers won't take you on. They're like, oh, you're too far along. They won't even accept you. Right. So I usually, especially a lot of mamas, because you're seeing an OB or a midwife or somebody before you're even pregnant. I start doing my interview questions then. Wow. Like my OBGYN, amazing. I love her. All gyne stuff. She did my IUD. Like she was amazing. But when I was pregnant, I stopped seeing her and I started seeing a midwife because I knew that was the care that I wanted. I knew I wanted a water birth. She wouldn't provide a water birth, and it's nothing against her in the hospital that she works at, but that wasn't the birth that I wanted to do. So I would look crazy to think, oh no, you're my doctor, but this is what I want. If she doesn't offer it, I would look crazy to see her the whole pregnancy and then get to the hospital like, oh no, I want a water birth. And they're like, we don't offer that. And then be mad at them now, Right. So yeah, I would say early.
As we wrap it up, I have a question. A couple of questions, actually. Let's just get to it. What inspires you?
What inspires me? That's a good one. You talking about like through midwifery, just
in life?
In life?
Yeah.
I don't know. Let me see. I'm trying to find a good way to answer this. Honestly, I feel like every day when I wake up, I'm doing the work that God put me on earth to do.
I love it.
So that is really my big inspiration. Just waking up and be like, even on the days where I don't feel like, doing anything, I'm like, you know what, God, you called me to do this, so I'm going to do it. And that's probably the main thing for me. It's most important. Yeah.
And for the younger generation who aspiring to go into midwifery, what advice would you give them?
Oh, I like that. Okay, so for them, I would say I've made it 3 little tallies that I would give them. First, I would say definitely keep God first because He'll guide you. He'll make sure you're on the right path and He'll open up the doors that need to be open for them. Another one I would say is just staying committed to learning. Because even after school, you have not learned everything. You don't know everything either. So kind of just still being open to learning more with each birth and as well as with each family that you interact with, because each one of those interactions make you a better midwife and a better person in general. And then lastly, I would say having a good mentor. So having somebody that is supportive of your goals and what you want to do. Because like I said, midwife, it doesn't always look like home birth. You might want to be a midwife in the hospital and helping out in that case. So just having somebody that's there that supports you and have your best interests at heart is also good.
Yeah.
I love that.
That's great. Was there anything you wanted to share that we didn't hit or anything you want people to know or wanted to say before we wrap?
Let's see. I did have a last little rapping thing. I feel like with birth, I want all women, no matter the birth that you aspire to have, that's at home, the hospital, a birth center. I just want you to feel empowered in that birth and supported and safe. So if you're with somebody, a provider, or seeing anybody that you don't feel that way with, then definitely look into getting more help as far as another midwife, doula, or even changing hospital locations.
Yeah, you're empowered to do that.
Yep, you are empowered to do that. Absolutely. You don't have to do anything they don't want. They say they do. You don't have to do anything. You've got rights. Always.
ATL Committee, Gather Around Podcast.
We out.
Out.
Hey.
Don't forget to like, save, and subscribe.
Okay, and that's also...
Baby. Don't forget to like, save, share, and subscribe.
You did good. You did
I
good.
wanted more energy.
Oh,
But it's okay.
Don't forget to like, save, and subscribe.
Now he's doing
and
too
share
We
it.
need to take a picture.